Hi, I'm Dr. Jerome Blackman, and this Thursday, I'll be offering an interesting and somewhat different class about supervision. Now, I'll be very interested in hearing your case vignettes and helping you think about the diagnosis, the dynamics, and the technique that you're using with different types of patients. And to do this, to some degree, you'll realize that I'm using Daniel Kahneman's ideas about thinking fast and slow. Thinking fast involves a little bit more primary process, thinking slowly, a little bit more secondary process and more detail. One of the things that I'm interested in is supervising people at different stages of their psychological, technical development. So if you're someone who has had a fair amount of psychoanalytic training in theory and technique, I'll show you how I would approach that with a different type of technique and supervision than someone who is a novice and just getting their feet wet. In the middle, between novices and experts, we have intermediate therapists, and I also approach intermediate therapy a little bit differently. So you'll see in the paper that I sent to Dr. Rosenspit that you can read a little bit about how I think about different stages of supervision. You'll also see, I think this seminar will be a little different in that it will be interactive. So I'll want to talk with you about your patients, and depending on your level of training, I may ask you some questions that you don't know the answers to. And at the same time, I'll illustrate to you the significance of obtaining certain types of information and how to get it. Most of the time during the initial evaluation, we need 16 or 17 questions answered somehow. But during therapy, I'll show you how to work with people so that we don't become the great inquisitor, the grand inquisitor, Torquemada. We're not going to interrogate patients. We want to look at how they defend themselves, how they resist, and also guide them in their associations a bit so that we can get a coherent understanding of what Brenner calls compromise formations. And I'll discuss that with you too. You'll see that what I want to do is not just offer some help in understanding the dynamics of the case, but I'll also try to illustrate to you how I'm going about doing that. And that's a task for me that I enjoy, and I hope you will too. A tip, if you're interested in the complicated diagnosis, then present a tough case. All right, so those cases, I will engage in some interaction with you so we can figure out what the dynamic diagnosis is, what the phenomenological diagnosis is. And to do that, we'll use about 8 different psychoanalytic theories simultaneously. And I'll help you with that. We'll use ego psychology, it's autonomous ego functions, ego strengths. We'll use different object relations theories in self-psychology, and we'll look at superego development. And then we'll take the whole question of compromise formation, which involves libidinal and aggressive wishes, conflicts with reality, conflicts with the superego, intrasystemic conflicts, the affects that are generated by those conflicts, and the defense constellations that arise that produce different syndromes depending on the defensive structure. If you're pretty sure about the diagnostic situation with your patient, and you have a personable patient who is who trusts you, understands symbolic thinking, and is able to integrate, use abstraction ability, and has some degree of superego functioning, so they're responsible people who have some guilt and shame, Then we can take a look at technique in dynamic psychotherapy, because we're not worried so much about the intactness of their mental functioning. We're looking for conflict that we can interpret. And with those kinds of cases, I will help you take a look at technique, all the variations of technique that Alan Compton described, how to find unconscious defenses, which I described in my first book, which is called 101 Defenses, and what to do with those realizations once you understand the unconscious, both the present and the past unconscious, as Sandler described it, and how to go about looking at defenses and compromise formations in the present day, the recent past, and the more remote past, and finally, how to use linking interpretations between past and present, resistance interpretations, and so on. So I hope you're interested in this sort of thing. I'm looking forward to the class. I've enjoyed teaching at the Object Relations Institute, and I hope that you can join me. As they say in Spanish, hasta luego.